Good morning, students and teachers. Today I will be talking to you about atherosclerosis. Atherosclerosis, also known as arterial sclerotic vascular disease, is a condition where the arteries become narrowed and hardened due to a build-up of plaque around the arterial wall. A recent News Medical article summarises the work performed by researchers at the Ben Gurion University and the Sheba Medical Centre, of whom have developed a new biomedical polymer to treat atherosclerosis and thus prevent heart failure. The normal physiological function of an artery allows for oxygenated blood to be pumped from the heart along the muscular arteries and to be delivered throughout the body. Arteries are composed of smooth muscle cells and elastic tissue, so they are able to modulate blood pressure and are also lined by a thin layer of cells called the epithelium, which keeps them toned and smooth, enabling the maintenance of blood flow. Atherosclerosis causes 56 million deaths annually and is mainly triggered by high blood pressure, high levels of cholesterol, smoking, and high levels of sugar in the blood. Think of atherosclerosis as a plumbing problem within your arteries, in which the endothelium is damaged, leading to a release of a molecule called E-selectin. E-selectin is a cell adhesion molecule expressed on inflamed endothelial cells in response to inflammatory cytokines, and results in the primary cause-up of plaque. Plaque is made up of fat, cholesterol, and calcium, which over time hardens and consequently narrows your arteries. In turn, this can limit the flow of oxygenated rich blood to vital organs and parts of the body. This build-up can be seen on the screen in comparison to a normal functioning artery, which is seen on top. This polymer targets the E-selectin molecule in order to minimise the existing plaque and further prevent the development of new plaque. This polymer has the tendency to be highly successful due to its several advantages. Unlike other polymers, it only targets damaged tissue and does not harm or influence the healthy tissue. It has no known side effects or limiting agents, making it approachable and easy to administer as it is not patient-specific. Finally, in comparison to the many other available treatments for atherosclerosis, this nanopolymer is the only proven therapy of which reverses arterial damage and improves heart muscle immensely. This new polymer, in an attempt to counteract the negative effect of atherosclerosis, was trialled and observed on mice. Atherosclerotic mice were treated with 4 injections of the polymer, and the change in their arteries was observed after a 4-week trial period. The results that were derived from the experiment proved that the novel polymer, of which targets E-selectin, was to a degree effective. A decrease in plaque progression and inflammation was observed in the disease-prone mice. There was also a significant decrease in the thickness of the arteries, as well as the overall myocardial function in the mice being drastically improved. This polymer could also be deemed as helpful for those with other conditions such as diabetes and hypertension. Despite its positive feedback, further development of the polymer is needed in aim to initiate a clinical trial and to then market the drug. Improved treatments and discoveries such as this have significantly reduced the number of atherosclerosis-related diseases. However, it still remains a prominent health problem. Simple changes to everyday lifestyle still remains the most effective treatment thus far, with simple measures such as healthy eating, physical activity, no smoking, and weight control drastically reducing your chance of developing atherosclerosis. Thank you.